So welcome again. We are in the part 2 of upper limb videos. Till now we have discussed about the arm, the forearm, the hand. The hand is yet to be discussed. The basics we have discussed earlier. The arm we have discussed axilla, the brachial plexus in the arm. Then the applied part of brachial plexus, the axillary artery. Then we have discussed the cubital fossa, its content, its applied part. Now we are going to discuss about something about the hand. So at the first we will discuss the anatomical snuff box. So what is anatomical snuff box? Basically it is a depression which we can see as well as feel. So how to feel? So extend your left thumb. Okay. After extension, feel the tendon which has been rose. Okay, and more laterally to it, feel the depression. This depression is anatomical snuff box, and remember your hand should be in anatomical position. So laterally to the tendon or superiorly to the tendon, you can see the depression, that is anatomical snuff box. Now we will draw the diagram at the first, and then I will enumerate the contents and the tendons of the snuff box. So this is the thumb, this is the ring finger, and this is the middle finger. This is enough for our diagram. Now at the first I will orient you to this. This is the right hand. Make sure this is in the anatomical position. Okay, now put your right hand in anatomical position. Okay, and see it from, and we are seeing it from below. Okay, so the thumb should be lateral. Okay, laterally placed, medial, this is anterior and this is posterior. Okay, now to see the anatomical snuff box, okay, the most lateral tendon will be abductor pollicis longus. Okay, so somewhat like this will be the abductor pollicis longus. Remember, laterally abductor pollicis longus, we are seeing it in anatomical position. It is hard to assume, but keep your right hand in anatomical position and assume you are seeing it from below. Okay, or you can easily get someone hand, or means tell someone to show the dorsal aspect, and you can then judge. Okay, now this is the abductor pollicis longus. Okay, it is going to the thumb and it causes the abduction. So abductor pollicis longus. More medial to abductor pollicis longus, we see another tendon which is, let me draw it first. Okay, it is extensor, as it is the dorsal compartment. It is the extensor pollicis and it is shorter, so brevis. Extensor pollicis brevis. So it causes extension of the thumb and it is a little shorter. So if their extensor pollicis brevis exists, so more medially extensor pollicis longus exists. Somewhat like this. This is extensor pollicis brevis. Oh, sorry, extensor pollicis longus. Okay, and this area, let me highlight it for you. This area between the three tendons, or rather between the extensor pollicis brevis and extensor pollicis longus, it is known as anatomical snuff box. Okay, this area is the anatomical snuff box. Now remember, more laterally abductor pollicis longus, then a little medially to abductor pollicis longus, extensor pollicis brevis, and more medially it is extensor pollicis longus, and the space between the extensor pollicis longus and extensor pollicis brevis is the anatomical snuff box. And remember, now an important part. What is the content? The content is the most important. So content is the radial artery. It is the radial artery. For example, like this is the radial artery. So radial artery. So this was all about the anatomical snuff box. Now we will go to the extensor retinaculum. So extensor retinaculum, it is basically a now extensor retinaculum. So it is a thickened band of deep fascia which is present on the dorsal aspect of the hand or the back of forearm on the wrist. Okay, so the extensor retinaculum is a bit confusing diagram, but I have a trick to remember the extensor retinaculum. So assume this is a hand. This is not as good, but this is a hand. If we cut the hand like this is the back of hand. Okay, so if we cut the hand like this, okay, and my eye is situated here. Okay, I cut the hand like this and my eye is situated here. Okay, so what we will see? So at the first we will see the radius. Okay, how will the radius appear? Like this. Okay, so this is the cut end of the radius, and this will be the ulna, somewhat like this. Okay, now assume this is the right hand. Okay, now I will give you orientation to the, this is the medial, this is the lateral, this is the superior, this is the inferior. Okay, now the extensor retinaculum, since it is at the back of forearm. Okay, back of forearm at the junction of wrist. Okay, so what is extensor retinaculum? Basically they are the tendons and some contents which pass to the extensor retinaculum. Now the extensor retinaculum is basically like somewhat like this. See, it extends from this radius and it goes to the ulna. It is somewhat like this. Now it has compartment. Okay, compartments which consist of contents. So this is the first compartment, this is the second compartment, this is the third compartment, this is the fourth compartment, this is the fifth, and this is the sixth. Okay, now how to remember the contents of this retinaculum? It is very easy. See, since we have studied the snuff box, okay, we know these two tendons which are laterally placed. Okay, so laterally we will show two tendons. I will write the short forms of the tendon. Okay, so this is, so the lateral most, what was the lateral most? It was abductor pollicis longus. Yes, and besides it, it was extensor pollicis brevis. Now we will jump to the third compartment. Okay, and we will show one tendon. So what was this tendon? This whole tendon, this was extensor pollicis longus. Yes, just a second, this was extensor pollicis longus. Okay, now this second compartment is a special compartment. Second compartment consists of two tendons. They are, just a second, they are ECRL and ECRB. What are they? ECRL and ECRB? Yes, they are the extensor carpi radialis longus and extensor carpi radialis brevis. Okay, so since they are different from the anatomical snuff box, they are a special content. Okay, and the fourth should be the biggest. Okay, why fourth should be the biggest compartment? Since it appear big. Yes, but yes, I am joking, just a second. It contains the tendons of extensor digitorum. Okay, and one more tendon, the extra tendon in upper limb in extensor compartment. What was that? Yes, extensor indicis. Now two main contents in the fourth compartment. It is one artery and it is a one nerve. So what are the nerve? So since the artery, or sorry, since it is the back of forearm or back of wrist, so this is posterior interosseous artery, but there is one twist. This is the anterior interosseous nerve. So why it is the anterior interosseous nerve? So basically the anterior interosseous nerve is present on front of forearm, but in the forearm it pierces the interosseous membrane between the radius and ulna, and it goes to the posterior side and opens in the extensor retinaculum. Therefore anterior interosseous nerve appears here. Okay, now we are going to the ulnar side, the medial side or the ulnar side. So the two tendons in the two compartments, and the names are, this is the extensor digiti minimi and this is extensor carpi ulnaris. Done. So this was about the extensor retinaculum. The extensor retinaculum consists of 6 compartments. First and third compartments contents of this nerve box according to lateral median, laterally extensor carpi, extensor pollicis brevis and abductor pollicis brevis, abductor pollicis longus. Okay, so first and third compartment extensor pollicis longus. Second compartment consists of, it is a special compartment, different tendons. So ECRL, ECRB, extensor carpi radialis longus, extensor carpi radialis brevis. So first, second, third compartment are done. Fourth compartment is the most important or most big compartment. It consists of 4 tendons of the extensor digitorum and 1 extra tendon in the extensor compartment, which is extensor indicis. It consists of anterior interosseous artery and posterior interosseous artery and anterior interosseous nerve. And the 5th compartment consists of extensor digiti minimi and 6th compartment extensor carpi ulnaris. So this was the contents, the boundaries, the attachment of the extensor retinaculum. This is the radius and this is the cut section of ulna. Okay, so what is the importance of this extensor retinaculum? This is a very creamy question. Importance. So the importance is, it holds the tendons in place. Okay, now this was all about extensor retinaculum.